Good afternoon, everyone. We are the Group 6 and we are here to present our topic regarding aphasia. What is aphasia? Aphasia is a neurological disorder caused by a damage to the areas of the brain that produce and process the language. A person suffering from aphasia may have difficulty of speaking, reading, writing, and understanding language. These abilities can be impaired in a variety of ways, ranging from mild to severe, nearly impossible to communicate in any form. The cause of the brain injury, extent in the area of the brain damage, and age and health of the affected person all play in a role in prognosis and brain recovery. So, aphasia is a language disorder that results from damage to portions of the brain that are responsible for language. For most people, these are parts of the left side hemisphere of the brain. Aphasia usually occurs suddenly, often as the result of a stroke or head injury, but it may also develop slowly, as in the case of a brain tumor. The disorder impairs the expression and understanding of a language as well as reading and writing. Anyone can acquire aphasia, but most people who have aphasia are in their middle to late years. Approximately 80,000 people acquire aphasia each year, with men and women being equally affected. Aphasia may make it hard for you to understand, speak, read, or write. It does not make you less smart or cause problem with the way you think. So next is the causes of aphasia. Aphasia is caused by damage to the language dominant side of the brain, usually the left side, and may be brought on by stroke, head injury, brain tumor, infection, and dementia. Aphasia can affect people of all ages, but it's most common in people over the age of 65. This is because strokes are progressive neurological conditions tend to affect older adults. Aphasia is most often caused by stroke. However, any type of brain damage can cause aphasia. This includes brain tumors, traumatic brain injury, and brain disorders that get worse over time. Aphasia is usually caused by a stroke or brain injury with damage to one or more parts of the brain that deal with language. According to the National Aphasia Association, about 25% to 40% of people who survive a stroke get aphasia. Aphasia occurs due to the damage to one or more areas of your brain that control language. When damage occurs, it can interrupt the blood supply to these areas. Without oxygen and nutrients from your blood supplies, the cells in the parts of your brain die. So, aphasia can occur due to a brain tumor, an infection, dementia or another neurological disorder, a degenerative disease, a head injury, and a stroke. Next is the symptoms of aphasia. A person with aphasia may speak in short or incomplete sentences, speak in sentences that don't make sense, substitute one word for another or one sound for another, speak unrecognizable words, not understand other people's conversation, write sentences that don't make any sense. Symptoms of aphasia vary from mild to severe. They depend on where the damage occurs in your brain and the severity of that damage. Aphasia can affect your speaking, comprehension, reading, and writing, especially expressing communication, which involves using words and sentences, receptive communication, which involve understanding the words of others. Symptoms that affect expressive communication can include speaking in short, incomplete sentences or phrases, speaking in sentences that other can't understand, using the wrong words or nonsense words, using words in the wrong order. Symptoms that affect receptive communication can include difficulty understanding other people's speech, difficulty following fast-paced speech, misunderstanding figurative speech. A person with aphasia often experiences both receptive and expressive spoken language difficulties, each to varying degrees. He or she may have similar difficulties in written language, for example, reading comprehension and written expression, As with spoken language, written language difficulties can vary in degree. For example, a person can have reading comprehension difficulties with or without written expression difficulties. For individuals who speak more than one language, languages may be affected by aphasia in different ways depending on when the language was learned, how often each language is used, and overall degree of proficiency in each language. Next is how is aphasia diagnosed?
How is aphasia diagnosed? Imaging tests such as magnetic resonance imaging or MRI and computed tomography or CT scan may be ordered. These tests identify the cause and areas of the brain that are damaged. Your physician may perform a basic language skills exam in which the patient is asked to carry on a conversation, name objects, answer questions, and follow instructions. If your physician suspects aphasia, the patient is usually referred to a speech-language pathologist for a comprehensive exam. This healthcare professional is especially trained in identifying and improving language and communication abilities. The speech-language pathologist will conduct tests to assess abilities such as grammar and to form sounds and letters, understanding comprehension of words and sentences, and object knowledge. Tests may involve pictures descriptions, using single words to name objects and pictures, matching spoken words to pictures and answering yes or no questions, and also following directions and other tests. Information of aphasia, extent of the disorder and prediction for successful treatment may be assessed and confirmed by a set of comprehensive language tests conducted by a speech-language pathologist. These tests include studying speech, naming, repetition, comprehension, and reading and writing. Making a diagnosis may also include the use of imaging procedures to look at the brain such as computed tomography or CT scan. This is an imaging test using X-rays and a computer to make a detailed image of the body. A CT scan shows the detail of the bones, muscles, fat, and organs. CT scan are more detailed than general X-rays. The second one is magnetic resonance imaging or MRI, a diagnostic procedure that uses a combination of large magnets, radio, frequencies, and a computer to produce detailed image of organ structures within the body. And lastly, positron emission tomography, a computer-based imaging technique that uses radioactive substance to examine the body processes. How is aphasia treated? Treatment is aimed at improving language and communication abilities and developing other communication methods as needed. Rehabilitation with a speech-language pathologist includes reading and writing exercises, listening and repeating words exercises, learning expressive language skills such as facial expressions and gestures to communicate, following directions exercise, and many more exercises. If traditional ways of learning to communicate are not successful, patients are also taught other ways to communicate, such as pointing to cards with words, pictures or drawings, handheld computers, tablet devices, Smartphones with accompanying apps can help people with aphasia communicate. There are also devices or apps that can be help it sentence or generate speech. Ask your speech language pathologist for recommendation about aphasia assistive technologies that may be best for you. Speech therapists can help you treat a people with aphasia. Treatment can be restorative, which means language can get better or recover. Treatment can be compensate or make up for having a difficulty in talking and understanding. There are a bunch of different techniques to improve language. There might be computer-based, therapy-based, and working with family or using music. Here are some tips to communicate to a person suffering with aphasia. Get an attention before you get start speaking. Keep an eye contact. Talk in a quiet place. Keep your voice at normal level. You don't need to talk louder. Use simple words. Use short sentences and repeat key words. Slow down your speech. Give time to speak to a person with aphasia. Try using drawings, gestures, and expressions. Ask simple yes or no questions. Let them make mistakes sometimes because they were not able to speak to say everything perfect at a time. How is aphasia can be prevented? The main cause of aphasia is stroke, so avoiding stroke can lower the risk of aphasia. Precautions that can be taken to do this includes exercising regularly, eating healthy foods, monitoring and controlling blood pressures, avoiding tobacco use, keep alcohol consumption low, managing stress. If someone shows sign of a stroke, it is important to get a medical attention as soon as possible, as this is crucial to recovery. Aphasia can be prevented after the stroke by doing some healthy lifestyle, some therapy and speech therapy for them to improve their language skills, and also for them to avoid having an aphasia. Types of aphasia. The first one is Broca's aphasia. This is form of aphasia is named after the person who discovered the area of the brain responsible for creating speech. Broca's aphasia is at times called motor aphasia. The term is used to show the ability to speak is damaged, but other language abilities stays mostly the same. Broca's aphasia results from damage to a part of the brain called Broca's area, which is located in the frontal lobe, usually on the left side. It's one of the parts of the brain responsible for speech and motor movement. Damage to Broca's areas occurs when a stroke interrupts a blood flow to the dominant frontal lobe of the brain. Typically, Broca's aphasia prevents a person from forming a clear words or sentence. But this has a little or no effect on the ability to understand others when they speak. If you have Broca's aphasia, you may be able to comprehend what is being said, but unable to speak fluently because your brain is having trouble communicating efficiently to all of the muscles needed to form words. This may create a great frustration. Since you know what you want to say but you can't get the word out of the way you wish to. Symptoms of Broca's aphasia includes poor or absent grammar, difficulty forming complete sentences, more difficulty using verbs than nouns correctly, difficulty articulating sounds and words, difficulty repeating what has been said by others, trouble with writing sentences. Fluent aphasia or Broca's aphasia. This person is struggling to think the word to say. They might say the wrong words such as saying fish instead of chicken. They might speak in very short sentence or use single words. People with Broca's aphasia may understand what other people say better than they can speak. They are more often aware of difficulty in speaking and understanding.
Wernicke's aphasia affects the area of the brain known as Wernicke's area, which is located on the left middle side. People with this condition have difficulty with language comprehension and may have a harder time in processing spoken words than those with Broca's aphasia do. People with Wernicke's aphasia also display a different type of speech pattern. Wernicke's is a type of a fluent aphasia. We also included the symptoms of Wernicke's aphasia. First, articulating sentences that have appropriate cadence but lack the right words. Second, jumbling words together in a seemingly arbitrary sequences. Lastly, inserting made-up nonsense-like words into sentences, being unaware that you may be articulating something incomprehensible to others. When we say Wernicke's aphasia, it is named after the person who discovered the areas of the brain that are responsible for our ability to understand languages. These areas are located in the temporal lobe. It is also the most common type of fluent aphasia. It occurs when the left middle side of the brain becomes damaged or altered. This part of the brain is known as Wernicke's area, named after Carl Wernicke, a neurologist. Wernicke's area of the brain controls the human language. It also near where we store our personal dictionaries. Someone with Wernicke's aphasia may have difficulty in processing the meaning of spoken words, and they can't understand others or even themselves when they are speaking. They also speak but with regular rhythm and grammar, but the words doesn't make sense with them. Anomic aphasia. People with anomic aphasia can find the words they want to use, and this is particularly true when trying to come up with the correct noun or verb. They get around the missing words by using many other similar words or filling in the blank spaces with vague filler like stop or thing. People with anomic aphasia understand speech and they can usually read, but you see the same difficulties in finding the right word in their writing. Anomic aphasia can also result in difficulty with naming an object. A person with this condition can recognize and understand what an object is and what is used for, but they have trouble in finding the correct word or name for the object. When we say anomic aphasia, it is the mildest of the aphasias, with relatively preserved speech and comprehension, but difficulty in words finding. The persistent inability to find the correct word is known as anomia. It is actually a symptom of all forms of aphasia, but patients whose primary language problem is word retrieval are diagnosed as having an anomic aphasia. In other words, patients with anomic aphasia have relatively preserved speech fluency, repetition, comprehension, and grammatical speech, but sometimes have difficulty with word findings. But
It also known as amnestic aphasia and nominal aphasia. It was a very frequent finding in aphasia to the extent that is considered imprudent to suggest a diagnosis of aphasia in its absences. Anomic aphasia refers to the aphasia syndromes in which the principal deficit is in confrontational naming, although spontaneous speech is fluent and easily produced. There is an emptiness which results from a lack of substantive words with substitution of many non-specific words that fail to communicate an idea satisfactorily. This output is called empty speech. Most often, excessive word finding typify an anomic output. Global aphasia. This is the most severe form of aphasia. People with global aphasia cannot speak many words and sometimes don't understand speech. They cannot read or write. People may have a global aphasia for a short period of time, following a brain injury or stroke, and then move into a different type of aphasia as their brain health begins to improve. It results from extensive damage to large areas of brain responsible for language. This type of aphasia can result in extreme difficulty with communication. Global aphasia impacts both the ability to speak and the ability to comprehend speech. Global aphasia is a disorder caused by damage to the parts of your brain that control language. A person with a global aphasia may only be able to produce and understand a handful of words. Often they cannot read or write. These are the most common cause of a global aphasia: stroke, head injury, and brain tumor. People with global aphasia may not have any other issues outside of language. They often use facial expressions, gesture, and changing their tone of voice to communicate. In understanding the global aphasia, it is a severe form of non-fluent aphasia caused by damage to the left side of the brain that affects receptive and expressive language skills as well as auditory and visual comprehension. Acquired impairments of communicative abilities are present across all language modalities, impacting the language production, comprehension, and repetition. Patients with global aphasia may be able to verbalize a few short utterances and use a non-word neologism, but their overall production ability is limited. Their ability to repeat words, utterance, or phrases is also affected. Due to the preservation of the right hemisphere, an individual with global aphasia may still be able to express themselves through facial expression, gestures, and intonation. This type of aphasia often results from a large lesion of the left percivilian cortex. The lesion is caused by an exclusion of the left middle cerebral artery and is associated with damage to Broca's and Wernicke's area and medullary regions, which are associated with aspects of language. Global aphasia, also a most severe from the aphasia, is applied to the patient who can produce few recognizable words and understand little or no spoken language. Person with global aphasia can neither read or write like in other milder forms of aphasia. Individuals can have fully preserved intellectual and cognitive capabilities unrelated to languages and speech. Global aphasia is also caused by injuries to multiple language processing areas of the brain, including those known as Wernicke's and Broca's area. These brain areas are particularly important for understanding the spoken languages, accessing the vocabulary, using grammar, and perceiving words and sentences. Primary progressive aphasia is actually a form of dementia, where people lost the ability to speak, write, and read over time. It's a gradual loss of language, moving from subtle to severe when in advanced stages. Primary progressive aphasia is a rare nervous system or neurological syndrome that affects your ability to communicate. People who have it and can have trouble expressing their thoughts and understanding or finding the words. With primary progressive aphasia, the impairments in language appear gradually and get worse over time. In many instances, the person with PPA may be the first to notice that something is wrong, and the changes in language may initially be attributed to stress or anxiety. Symptoms vary from one person to the next. The initial symptoms can include: first is slow speech. Second, word finding hesitation. Third, sentences with abnormal word order in speech or emails. And lastly, using words that are mispronounced or incomprehensible. Symptoms begin gradually, often before age 65, and worsen over time. People with primary progressive aphasia can lose the ability to speak and write, and eventually to understand written or spoken languages. This condition progresses slowly, so you may continue carrying yourself and participating in daily life activities for several years after the disorder onset. Primary progressive aphasia is a type of frontotemporal dementia, a cluster or related disorders that result from the degeneration of the frontal or temporal lobes of the brain, which include brain tissues involved in speech and language. When we say primary progressive aphasia, it affects a person's ability to use language to communicate. This includes difficulty in making the understanding in speech. Primary progressive aphasia is a specific type of a more general disease called frontotemporal dementia. It also caused by a loss of tissue or atrophy in the area of the brain that is responsible for producing language. In some cases, this loss of tissue is caused by genetic changes, mutation, or pathogenic variants in the GRN gene. Moreover, it is a clinical entity differentiated from other forms of neurodegenerative disease in that language difficulty is the most prominent clinical features and the primary case of functional impairments and onset and during the first year of disease. It also caused by the generation of the language network, and recent neuroimaging studies have established the association between particular patterns of neuroanatomical damage and clinical presentation. It was also the behavioral syndromes characterized by gradual deterioration of speech and language function in a settings of initially preserved intellectual and social skills. There is considerable heterogeneity in the language manifestations, but an early progressive dysomnia that may be more pronounced in spontaneous speech than on measure of confrontation naming is typically present.